Access Community Health Network lives up to its name, providing access to primary and preventative care to residents across Illinois. Everything from pediatrics to internal medicine, women's health, behavioral health, and even care coordination. The mission is to make sure care is affordable and high quality. I spoke with Dr. Hazel Helo to learn more. Dr. Helo, thank you so much for joining us. Can you tell us about the Access Community Health Network and the mission?
Yes, absolutely. So Access Community Health Network is the largest federally qualified health center in Illinois. We have 35 health centers spread throughout Chicago, suburban Cook County, and DuPage County. And our mission is simple, and it's something that I'm so proud of. We provide quality, comprehensive, affordable health care to people of all ages in their own communities.
It makes people very comfortable when they can see somebody as part of their communities. What advice do you have for parents right now as kids are heading back to school?
It is back to school season, and it is a great time to bring your child in to their primary care provider for a checkup. But I also want to say that any time is a good year for that visit and should be done every single year. So the well child visit is so important because it gives us an opportunity to make sure that your child is growing well, both physically and developmentally. It's a good time to catch them up to date on any necessary vaccines or screenings. If they have any chronic medical conditions, we follow up on that. And of course, it's an opportunity for parents to raise any questions that they may have.
Yeah, because you might be able to catch something early on, motor skills or something like that, that may not necessarily be medical, but the doctor could spot.
Absolutely, absolutely. And developmental screening is so important.
Yes. Okay, so physical and mental health, both really important. Why specifically right now?
The return to school season is often a big transition for many children. So we just want to make sure that they are developmentally and emotionally well balanced and resilient to take on all of the changes and challenges that may come with the school year.
I think a lot of time as parents, especially, I think of the high schooler as that being difficult, but I forget for the elementary school kids too, it's tough as well.
Oh, absolutely. And even the younger preschool, kindergarten ages as well.
Yeah, big changes that happen in their life. Okay, we talked a lot about the kids going back to school, and we know they have to have their physicals.
Yes.
But what about the parents as they're sending the kids back to school? Is it a good time for them to also make sure they are healthy?
Absolutely. Just as important as it is for children to get their school physicals, it is just as important for parents to get their annual checkup and screenings. When kids see their parents taking control of their health, they grow up learning to do the same.
And if you're trying to remember a good time of year to get it done, modeling after your kids' time of year is really smart.
Right, absolutely. And at Access, we see the whole family. So bring in your kids for their school physicals, and we'll see you for your annual visit.
You guys also offer wraparound services. Can you explain a little bit about that?
Yes. So good health is not simply a focus on the physical or the mental needs. It's so much more than that. And we understand the importance that social factors play into your overall health and well-being. So, for example, do you have enough food to eat for the week? Do you have safe and secure housing? Do you have adequate transportation to and from your doctor's visits? And at Access, we have a dedicated team who looks into these social determinants of health and links patients to care if needed.
Because I imagine, too, there's also there's a pride factor in there, too. They may feel uncomfortable or embarrassed talking about what they don't have. So for you guys to be able to afford that for them, it takes that away for them.
It's a screening that we do for all patients.
Yeah, so no one is individualized in that one, too. How does Access make care both affordable and high quality?
Access is here for everyone. So whether you have Medicaid, Medicare, commercial insurance, or no insurance, we have a sliding fee scale to make sure that quality health care is affordable.
Yeah, because the last thing a person wants to do is ignore something and then end up in an emergency room instead of seeing a regular doctor.
Absolutely, absolutely.
Thank you so much for being here. We appreciate it.
Thank you for having me.
All right, grab those phones and scan the QR code on the screen for more information about Access Community Health Network. You can also visit the website at achn.net or give them a call to make an appointment today.